Dear colleagues, followers of Obstetrics and Gynecology Ultrasound for All page on Facebook, thank you for following my page. And concerning the live quizzes published yesterday, actually I wanted to mention this picture at first. As you can see from the question I mentioned here, that it's a TVS, transverse section of the uterus, and it's of course a transvaginal approach. And when I asked about this picture specifically, I wanted you at first to see that this is a transverse section, and of course, as you can see, this myoma is a huge myoma which is encroaching on the endometrium. And so, if you remember from the next picture here, in that longitudinal section of the uterus, I said in my question again, this is a longitudinal section of the uterus, and this is a TVS, transvaginal sonography, and so I asked you to comment. Of course, you should remember that in many cases of the fibroid or myomas, the anatomy is disturbed, is completely disturbed. And so it's very important at first to know what's the anatomy or how to have a good perception of the picture you see. You can see the endometrium here. This is the triple line endometrium. And here in this picture, I'm trying to give you a picture for this part and another picture here for that part. So this is a condensation, or this is an area, and this is another area. Many of you had mentioned this picture. I had many comments here, like some of our colleagues mentioned that this is a focal adenomyosis, and she said, or submucous fibroid with cystic changes. So she had mentioned two different categories or two different differential diagnoses. And the same others had mentioned that there is a fibroid which is Figo 3 to 5. Some had mentioned a prominent ovary. Of course, this is not an ovary. So that's actually a very false impression that you think that this is an ovary. If you can see the uterus, these are the borders of the uterus. These are the lines or the outlines of the uterus, as you can see here. And of course, there is a mass here, and it's well circumscribed, as you can see. This is a myoma, and of course, it's mainly subserous, but it's encroaching on the myometrium, but not reaching the not reaching the endometrium. And so this is not a submucous myoma. This is an intramural myoma and two subserous. It's getting outside the uterus, so it's partially intramural and mainly, or a very big part, is subserous. I don't want this picture, I want actually the next one. So this picture is the transverse section, and actually I'll show you another picture I wanted, which is a reminder of the new classification of Figo. So please look at this new classification. I gave you again a reminder of this new classification for myomas by Figo. 0, 1, 2. In all these parts, still there are parts submucous. We have part of the myoma which is submucous. When it is a polyp, a pedunculated polyp, so this is stage 0, in which the whole polyp is inside the endometrium. When you have more than 50%, less than 50% intramural, so more than 50% is in the cavity. And when less than 50% inside the cavity, so more than 50% is inside the myometrium. Actually, the importance of this classification is mainly for hysteroscopic resection. If you are going to have an operative hysteroscopic intervention for these myomas, so you should know which myoma can be resected by hysteroscopic intervention and which is not, or which are not. For an example, this, we have 100% is intramural, but still it's abutting the endometrial part. And accordingly, of course, we can, for example, you can say 2 to 5, that means that is still abutting the part of the endometrium, and still it's intramural, and the part also is subserous. So getting again to the picture, you can determine the degree of this myoma. You can see it's here encroaching on the endometrium. This is, of course, these are two different pictures. This picture is for transverse section of the uterus, in which you can see the myoma is encroaching on the endometrium and is getting outside, reaching subserous. So this is 2 to 5, according to the classification we mentioned. But the other picture, in which actually I was not convinced, and I didn't like those who said that this is an this is an ovary. That's not a good perception. So, and that's why actually I publish these pictures, and I'm giving you a time to think of these life quizzes, and then I discuss it with you again. And I noticed that when I just write the answers and discuss it with you, just like answers, you need to hear or to listen to me, how to explain the false impression or the false diagnosis. And that's why actually I delete all these live quizzes after a few hours. That's because I know some of our colleagues are embarrassed of having wrong, for example, perception or wrong answers. I know that we are still learning and we just want to learn. So there is no need to have these false answers or wrong answers to be present on the page. I just want you to learn. So this is triple endometrium. This is the uterus. These are the borders and the outlines of the uterus. I know this case is difficult, and so no problem to be just confused, a little bit confused, but you have to see many pictures and many cases in which they are altered anatomy, and you find altered anatomy for these cases, and so you have to know the differences between each picture and the other. And of course, especially concerning the leiomyomas or the myomas, you will find a huge variety. So many cases and so many different pictures for the different leiomyomas and their presentation. And that's why actually the Figo classification was very expressive for the different types of myomas, to understand what are the degrees or the varieties of these myomas. So in this case, you can see the endometrium, triple line endometrium, and this is the fundus, and this is towards the cervix, and this is the myoma. We have two myomas, one with cystic degeneration, and the second is posterior, in the posterior wall. Of course, you can see up to. Sometimes we see the degeneration of the myoma reaching to a cystic area, a completely cystic area. You can find a cyst inside the myometrium, and it's very confusing for many that the cystic degeneration of the fibroid reached a picture of cyst inside the myometrium. And so that was a cystic degeneration of the myoma. The picture of the focal adenomyosis is completely different from this picture. So this is a multiple fibroid uterus, and as you can see, the different pictures of these myomas. Thank you.